Hi, everyone, and welcome to another episode of Mind Body Balance, where we do the deep dives into all things health and wellness. And if you're new to the channel, welcome. Now, in today's video, I'm going to be talking about water fluoridation. If you're concerned about water fluoridation and how it's been used as a delivery vehicle for medication, maybe you've been curious or even skeptical about fluoride, or perhaps you're a convicted advocate of water fluoridation. Well, either way, stay tuned, as I guarantee you, by the end of this video, you will have a very different perspective. Now, fluoride, specifically its addition to the water supply, has once again become somewhat of a controversial and popular topic in media discourse in recent months. And that's on the back of a federal court case decision in the USA, where they ruled that water fluoridation poses an unreasonable risk to human health. So to start with, I just want to clarify something. Fluoride is not a nutrient. It is highly toxic, corrosive, a neurotoxin. And in addition, it disrupts the function of the endocrine system due to compromising the thyroid gland and competing with iodine at receptor sites on the thyroid. It also negatively affects bone mineralization and density, and it is a carcinogen. Now, when it comes to community water fluoridation, or adding fluoride to drinking water, this is a common practice, pretty widespread in the USA, Canada, UK, Australia, and New Zealand. And the consistency and conformity of this in these 5 nations may give you a sense of comfort, but don't be fooled. The practice is not widespread globally by any standard. For example, 97% of Western Europe rejected water fluoridation. It's entirely absent in Eastern Europe, and India and China have no national fluoridation program. In fact, they focus on removing fluoride from areas where it occurs in high concentrations in public water due to negative health effects. Now, with that in mind, consider this quote from the Fluoride Action Network website. It says, the US Center for Disease Control hails fluoridation as one of the top 10 public health achievements of the 20th century. But despite this claim, tooth decay rates have declined in Europe as precipitously over the past 50 years as they have in the United States. Well, this raises some serious questions about the CDC and its assertion that the decline of tooth decay in the United States since the 1950s is largely attributable to the addition of fluoride and community water fluoridation. Now, to be clear, I'm not disputing the fact that topical application of fluoride to the surface of the tooth has been demonstrated to strengthen teeth, and this supports the remineralization of the enamel, hence why it's added to toothpaste or topical dental treatments. However, the reality is when it comes to consuming and ingesting fluoride in drinking water, there is no science showing a benefit to teeth and dental health by ingesting fluoride. And the effect of strengthening teeth is not accomplished by ingestion. Yet there are numerous studies that show the detrimental effects of ingesting fluoride, even in the quantities consumed from drinking fluoridated tap water. For example, there are 64 studies showing a link between fluoride ingestion and reduced IQ in children. In contrast, there are no studies which show statistically significant variance between dental health in areas where water is fluoridated versus areas where it is not fluoridated. What is also of serious concern is the fluoride used in community water fluoridation is not a pharmaceutical-grade sodium fluoride. It's hydrofluorosalicylic acid, which is an industrial waste product, and it's typically extracted from the chimney scrubbers of factories used by the phosphate fertilizer industry. The fluoride extracted from these chimneys also contains a range of other toxic substances, such as heavy metals like mercury, lead, aluminium, and cadmium. So now, instead of industries which produce fluoride as waste having to incur the substantial costs of responsibly disposing of this toxic byproduct, big businesses and your government and local council, surprise, surprise, have partnered up and decided to use your tax dollars to buy Yes, that is right, by toxic waste from corporations who previously had to pay large sums of money to dispose of this hazardous waste product. What absolute genius. Then, millions of additional tax dollars have to be spent on the equipment, tools, and manpower to then dump this highly toxic sludge into our water supply. You are literally paying to poison yourself and to have your body used as a dump for toxic industry waste. Remember, it would be very easy for the government to use just a fraction of the money spent on community water fluoridation to subsidize the purchase of pharmaceutical grade fluoride and make this available to anyone at a pharmacy who wants to ingest it, free of any costs, and therefore not having to dose the entire population's water supply with a toxic waste product. Now, authorities will claim there is no correlation between industry toxic waste and community water fluoridation, but this is patently false. The introduction of fluoride to community water supplies intersects directly between the restriction of disposing of fluoride into the public waterways, landfill, and ocean off the back of lawsuits against the phosphate fertilizer industry by communities who were suffering the toxic effects of fluoride pollution, who lived near plants which produced phosphate fertilizers. And let's not forget the aluminum industry. In America, it was dealing with a huge issue with toxicity, which was being caused by the fluoride that was produced as a result of the aluminum smelting process. As a result of these lawsuits, fluoride was categorized as a toxic waste product, and the phosphate fertilizer and aluminum industry had a consequent issue. Now they had to deal with the crippling financial problem due to the high cost of disposing of fluoride due to its classification as a hazardous waste product. And what do you know? Say hello to the genius idea of community water fluoridation. Let's put all that pesky waste into drinking water and sell it to the government instead of paying to dispose of it. The other issue with water fluoridation is dosage. If I go to a pharmacy and buy sodium fluoride because I decide I want to drink it for some reason, I can get tablets which will allow me to precisely control the dosage I take each day. However, when governments administer fluoride by adding it to tap water, you can't control the dose each recipient receives. And this contributes to excessive ingestion of fluoride in quantities where it is even more harmful, especially since fluoride already exists in many foods and popular beverages which are regularly consumed, such as black tea. Consequently, there is no way to control or monitor the quantity each individual in the population is consuming, as one person may already be getting significant amounts of fluoride from their diet in addition to what they consume in tap water. Water fluoridation also doesn't factor in the need for dosage to be adjusted by body size, age, or potential health conditions. The fact that fluoride is not a nutrient means public water fluoridation is essentially forced medication by the state using the water supply, which raises a serious ethical question. Should the state have the ability to mass medicate the entire population without their consent and using water, a necessity of life, as a way of administrating medication, executed based on what the state believes delivers a desirable outcome for society? Especially considering if an individual is advised by a medical professional that fluoride may be beneficial, they can easily obtain it from pharmacies as a medicine, which allows them to have a precise dosage without the requirement again for the whole community to be subjected to involuntary fluoride ingestion and unavoidable mass medication. Water is a shared, essential communal resource, and the state mandating medication of the water supply or adding any chemical or pharmaceutical for any purpose other than removing impurities and the sanitation of water, and doing so under the guise of public health benefit, is an abuse of state power via its monopoly and centralized tyrannical control of the water supply. Education and initiatives to improve oral hygiene, access to dental care, along with dietary changes, have been proven to substantially improve community dental health and reduce incidence of cavities without needing mandatory fluoridation. The vast majority of the world does not add fluoride to the water, and there is no scientific evidence to show any statistical difference in the dental health outcomes in countries which fluoridate water and those which do not. However, there are numerous studies showing the detrimental health effects from regularly ingesting fluoride, aka in your drinking water, even at low doses. For years and years, the medical establishments and experts have lied and misled the public. We were told that DDT was safe and smoking didn't cause cancer, and glyphosate was safe and asbestos was safe. Again and again, after many injuries, suffering, death, court cases, and protests, the lies and collusion of government and industry are finally revealed. We need to ask ourselves, do we want to support an approach or methodology by the state which takes away our choice and discretion to make decisions about our own health and medication, and instead accept or endorse a regime where the government mandates medical treatments, which is invariably biased and influenced by lobbyists and corporations, allows the pollution of an essential to life? To medicate the population or accomplish the goals and objectives of lobby groups and powerful interests and corporations. COVID definitely has shown us the danger of unilateral implementation of health protocols or medical interventions by the state, and with the inevitable clandestine influence of big business causing catastrophic negative effects to the mental, emotional, and physical health of the population. With such interventions, it's often later revealed that they failed to deliver any of the benefits and protections which were emphatically declared at the time as indisputable science and completely beyond critique. Remember those three words: safe and effective. Similarly, when it comes to fluoride, those who question the official government narrative are dismissed, derided, and ridiculed for their warnings and their skepticism. Let us learn from history and not repeat the mistakes of the past, and send a clear message to our elected officials and councils. Our health choices and decisions to take or not take medicine is our choice alone, and they have no place using their monopoly of power and control to exploit something as sacred as water for the purpose of medicating the population without their consent. I hope you enjoyed this video. Please like, share, and subscribe. It really helps the channel. And if you're interested in further educating yourself regarding fluoridation, I encourage you to buy the books The Fluoride Deception by Christopher Bryson and The Case Against Fluoride by Dr. Paul Connett, who is the Executive Director of the Fluoride Action Network. Please also have a look at the Fluoride Action Network's website if you're in America or Australia, and Fluoride Free New Zealand's website. The links are going to be below. And consider, if you can, making a donation or supporting the incredibly valuable work that they've been doing. Remember, nothing will change unless you work to change it. Doing nothing and hoping or waiting for someone else to take action or make a stand is the reason why so much of the corruption, human rights violations, government tyranny, and abuse of power and equality we see today exists. Until the next time, be well and be blessed.